Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
Laws are being drafted and debated at the State House right now. Laws that will likely affect your everyday life as an Idahoan. The Connector helps you keep up with the legislative session with clear reporting, local context, and explanations that make it all make sense. Stay connected to the State House with the Connector, Idaho Daily News. Listen wherever you get your podcasts.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. This winter's respiratory virus season is proving to be a tough one for families all across the country. In fact, new numbers from the Centers for Disease Control and Prevention show pediatric flu deaths continue to climb, and most of these children have not been vaccinated for the flu. Now, at the same time, flu activity remains high in many states. RSV and COVID-19 are still circulating, adding pressure on hospitals and raising concerns for parents who are heading into these late winter months. It is Wednesday, which means Dr. David Pate is joining us. He's the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma.
Folks, remember, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. So, Dr. Pate, what is standing out to you most about this high percentage of children who have not been vaccinated against the flu and now the CDC is reporting unfortunately the majority of these children who have died from the flu were not vaccinated. So what is this telling us about the risk right now?
Well, we knew, and you and I discussed on the show a number of times, we knew going into the season it was likely going to be a bad one. We mentioned that because of the fact that we had a different strain than the general type of strain that we usually have every year. Usually we have an H1 virus. This time we were having an H3 virus. So we already knew that was going to be bad. Then you and I talked about the fact that it had gone through about 7 different major mutations just over the summer while it was circulating in the southern hemisphere. And that we talked about that was also going to likely contribute to more illness because it was getting further away from anything that possibly we would recognize. And then during the season, when we saw this B strain, which is not unusual, but it does typically tag on towards the end of the flu season after A is already peaked and maybe starting to come down, then seeing B. And when I talked to pediatricians here in the Treasure Valley, and they said, oh yeah, they were seeing lots of B very early, I thought, that's going to be a problem. And B is usually a problem for kids. And that's exactly what we're seeing right now. Mm-hmm. And we should keep in mind the determination of children that die from influenza has a significant lag period because it's a difficult determination to make. It takes a lot of time. So we will see many more, unfortunately, deaths. But I think one major misunderstanding is that people think, well, these were probably, very sickly kids, a lot of problems. That's not true for at least half of them. Half of them, you would not expect that they would have a problem with the flu, and yet they died. And so that's really tragic.
And Dr. Pate, anecdotally, our senior producer, Sam, she and her husband are out with the flu. And when she went into the doctor, her doctor told her that this is the worst flu season he's seen in 30 years. It seems to be a fairly accurate assessment.
Yeah, it is shaping up to. We won't know till it's over, obviously, and
Hmm.
last year was a very severe year. But I had actually mentioned with you in previous weeks that we very well could be on track for this to be even worse than last year, which was kind of setting a record for a few decades, just as that doctor mentioned. We'll have to see, but yes, it's got all the recipe is there for that to happen. A highly mutated virus, low vaccination rates, and another thing, like you and I talked about one time before, is a lot of people are dismissive of the flu, influenza.
Hmm.
They think it's just another cold, and as you and I talked about a couple of weeks ago, it really is different, and more people do die from flu than common colds, and it can also have lingering complications. Like we know that in the months following influenza in middle aged and older adults, the rate of heart attacks and strokes goes up, and so it's not innocuous. And I'm hoping that at least maybe one thing that comes out of this is that maybe more people will get their flu shots for next year.
So let's move on to the measles, Dr. Pate, because it's continuing to spread across the country. And now, this is interesting. Many hospitals and doctors are finding themselves face to face with the measles, but having to diagnose it. But many healthcare workers have never seen it before. So, why can measles be so difficult for clinicians to recognize early? I mean, especially for these providers who have never treated a case before. And I would assume that goes back to the fact that we'd basically eradicated this almost 26 years ago.
Well, you're exactly right, and so because of that, most doctors out in practice today have not seen a case of measles. So that is one reason. The other reason is that early on in the infection, um, a case of measles can look a lot like a lot of other common respiratory infections,
Mhm.
especially when it's occurring at this time of year when we're seeing COVID and RSV and influenza. And kids are more likely than adults to get a rash with viral infections, just in general. It takes clinicians being on the lookout for measles. There are some things that help distinguish measles from common colds. First of all, whenever you're in a state that's having an outbreak, like if you're in South Carolina, you need to be on high alert that a child with fever and rash, there's a good chance. Let's be very conscious about measles, but with measles, the rash is different than what we see in most common viruses. First of all, it typically is much more prominent. Second, it comes. It starts at the head, moves down to the trunk, then goes down to the legs of the child. And a lot of times when we see rashes with other viruses, it just kind of comes on all of it at one sudden, and it tends to
Mhm.
be more on their trunk area than on their head. So that's distinguishing. And then there's a particular sign we can look for in the child's mouth that we don't always see with measles, but when you do see it, it's a telltale sign.
Okay, so Dr. Pate, you just talked about some symptoms. Are there symptoms that should immediately raise concern and have a caregiver or an individual maybe who has experiencing these symptoms to isolate or to get medical attention pretty quickly?
Yeah. So first of all, if you're aware that in the prior 2 weeks that your child was exposed, so let's say that your child's school told you that a couple weeks ago there was a child with measles, or maybe you were traveling and there was a report that there was a case of measles in the airport that you went through at the same time that you were traveling.
Hmm.
Um, any of those things where you know there might be an exposure and you know that your child is immunocompromised or your child is not vaccinated. And then if they are getting, particularly, we often see higher fevers with measles than we do with colds. A lot of times, kiddos will get, a temperature of 100.5, something like that with viruses. They certainly can be higher, but when you see a higher fever, 103, 104, that kind of thing, that's going to make you be on the alert that, this may be measles rather than one of the common colds or viruses. And then I think the other signs of it's much more common with measles to have conjunctivitis, inflammation of the eyes, than it is with the typical viruses that we see. They certainly can cause that in some cases, but if you know of an exposure, the time is right, the fever's high, they've got inflammation of their eyes as well, the rashes is kind of starting on their head and face and moving down, and it seems to be much more prominent than what you've seen. All of those are signs to be very much aware of measles. And to that point, Gemma, about your very good question about isolating, if you're going to take your child to the doctor or the emergency room, call ahead first, because what we don't want is, if it is measles, we don't want your child sitting in the waiting room exposing everybody else that's in there to measles. So call ahead that you're coming.
Okay, that was actually going to be my next question, Dr. Pate, is how significant is the risk of hospital exposure if measles isn't identified quickly?
Very, very. So this virus gets into the air, and if you have a child sitting there in the emergency room or in the office and they have measles, they will likely infect 90% of the people that are in that room that are susceptible. So this could be babies that are too young to be vaccinated. It might be other unvaccinated children. It might be somebody that's immunocompromised, but it's a very high rate of exposure. And not only that, but that virus lingers in the air and can stay in the air for an hour after the child is even taken back or leaves from the department. So it's a huge risk, and that's why we'd rather know ahead of time that this is a possibility, because we don't want to take you into that waiting room. We want to divert you a different way.
So what does the return of these measles outbreaks tell us about vaccination rates and public health preparedness right now?
So what it tells us, the fact that we are having these sustained outbreaks. So what we've seen is you and I started talking about this a year ago when there was the Texas outbreak, and then we've seen this spread to other states, and now South Carolina is having a bigger outbreak than even happened with Texas initially. So what this tells us is that vaccination rates with the MMR must be likely less than 93%, and probably it would not be surprised at all if it's below 90%. And so that is telling us that's why we're having these outbreaks, because if we can maintain the vaccination rates in populations of people that will be interacting. So, the people that are going to that church, the people that are going to schools, if we can keep vaccination rates at above 93%, we typically don't see outbreaks, even if there's an isolated case. But this tells us it's lower than that. Then what that tells us is, because, measles is the canary in the coal mine. Because it is the most infectious, that's the one we're going to see outbreaks of first. But what I'm watching for is what's next, because if we start seeing other diseases like mumps and rubella, then we know probably the vaccination rates are probably in the low 80s or lower, that means we're going to be vulnerable to, many different kinds of outbreaks. And we're going to start seeing really terrible consequences like we used to see of all these various diseases.
So, Dr. Pate, some new research is out and it's pushing back on several high profile health claims from federal officials about vaccines as well as medications during pregnancy. So now we've basically got competing messages going on, right? We have information coming from federal officials and then, many doctors who are refuting that. And now we have this research that is also refuting that. So, with all that said, how should patients and families start sorting through these messages when political leaders and scientific studies appear to say very different things about vaccines and medications?
Yeah, this is of great concern to those of us like me that are trying to straighten out all of this disinformation. There's just so much of it. And unfortunately, like you said, a lot of it's coming from the highest levels of our government, with RFK Jr. as Secretary of Health saying things that we have repeatedly been able to show this is false. And I think that once we show that somebody is saying something false and then we subsequently do it again, that's time to say, I'm not sure I'm going to believe that person. And lately we've seen problems with the same thing with the FDA director, Dr. Macri, who's been saying some things. And I do want listeners to be equipped to be able to evaluate some of this for themselves. So, for example, one of those claims that there's a study to debunk is that raising alarm about antidepressants during pregnancy. And so here, what I want your listeners to think about. Here was Dr. Macary's statement. He said, the more antidepressants we prescribe, the more depression there is. What I want you to do is think about that sentence for a second. The more antidepressants we prescribe, the more depression there is. Well, what he's trying to say is it's because of the antidepressants. But then ask yourself, do antidepressants cause depression? No, it's the opposite. The reason we're prescribing more antidepressants these days is we're finding more depression. So that's one thing. The other thing that you can look for with these government spokespeople that are giving false information, like RFK Jr., Dr. Macri, is when, for example, when they came out about the Tylenol scare, when they most recently came out about the antidepressants, look to see, well, did the agency take action? Because Dr. Macri is making this statement trying to get people worked up and maybe not take the antidepressants during pregnancy. But what did the FDA itself say? It said, we're going to look at the data. Well, there you go. What that means is Dr. Macri is making a statement about what the concern is when the agency is saying, we need to look at the data. So they haven't made a determination. That's a way you can kind of piece this together, that they're giving you disinformation. The easier way is just go to sources that are trusted. Obviously, you and I will try to get good information out to people, but if it's a pregnancy issue, go to the American College of Obstetricians and Gynecologists, ACOG. Go to their website and you can find. If it's something for your kids, go to the American Academy of Pediatrics and their website. Those are places you can find good information.
So, Dr. Pate, from a public health perspective, I mean, and I know we've talked about this, but I think it's important to bring it up again. And this is the importance of consistent evidence-based messaging coming from federal health agencies. In particular, how important is it right now when, in our last segment, we just talked about, one of the worst flu seasons we're seeing, right? Where we have a measles outbreak that is continuing. And we've had children die from both of these diseases.
Well, it's critical, Gemma, and I thought it was a reveal after all the things that RFK Jr. had done to downplay when we had the Texas outbreak a year ago, downplayed taking the vaccine. He was suggesting all kinds of other ways to manage measles, which are not appropriate treatments, like taking cod liver oil and vitamin A and all other kinds of nonsense. And after all that time of discouraging the MMR vaccine, which is as you and I talked about a week ago or so, that's the only way that you can control an outbreak. Now that the outbreak's getting worse, Dr. Oz, the head of CMS, was interviewed, and he had to start making the plea for people to take the vaccine, because now they were in such a bad situation after they had done so much to discourage it. And they often say that they're trying to figure out how they can improve vaccine confidence. Well, I would tell them the way you can improve that is stop spreading disinformation. You just look in the mirror. You can find out why there's vaccine. It is not a mystery, people.
And Dr. Pate, we should note really quickly that the confirmation hearing for Dr. Casey Means as Surgeon General is underway right now. And her views align very, very closely to RFK Jr. So, what could that potentially look like, if she is confirmed to this position? And we should know she never finished residency, correct? I mean, I know she's a doctor, but
and same thing for the director of the NIH. He never practiced, never finished his training. It's kind of amazing to those of us in the profession that really in the whole country of the United States, you can't find well-qualified physicians for these positions. And the reason they can't, we already saw what happened. They did make a appointment of a very well-qualified physician for the CDC. She lasted, I'm not sure exactly the time. I think she lasted 2 months until RFK Jr. was trying to get her to do something that was objectionable based on the science. And so she had to go. And so the fact that this candidate is in line with RFK Jr., that's not surprising, because that's the only way they're going to last. But on the other hand, what it means, it will be one more mouthpiece with a very high level title to make people think that, well, this person must know what they're talking about, who can further amplify disinformation, which is exactly what we're dealing with now. So the problem's only going to get worse.
So, Dr. Pate, the Food and Drug Administration is also proposing a major shift in how new drugs are approved. So they're moving away from a decades-old requirement that you have to have 2 major studies so that you can approve a drug. So supporters are saying this could speed up treatments, but critics are warning this might raise some new safety questions. So in your opinion, what are the potential risks or benefits of approving new drugs based on a single clinical trial instead of 2?
Well, in general, I think this is a good concept. I'm actually in favor, with a little caveat here. The problem is, if it's going to be one bad study, would I rather have 2 good studies? Yeah. So first of all, we have to talk about the quality of the study. But if you have one good quality study, then that's fine. And we have very good statistical means to determine whether studies are good or not. And so I'm not overly concerned. I think there are certainly cases where we would greatly benefit getting these drugs out to the market sooner. And we have the safety monitoring systems in place. So, those people that spread disinformation badly misuse those systems and their data. But people that know what they're doing, we have very good safety mechanisms. What I think it means, though, is that we do have to be careful if we're going to rely on one study and it's a particular population. So, for example, if it's adults, that doesn't necessarily mean it would be the same results in kids or vice versa. Obviously we can trust technical experts to realize how far should you apply that study. But in general, it's a good thing. What's not good is that, and I've told your listeners over and over, one way to spot when people are not being honest with you is when they're not internally consistent. And in this case, the FDA is not being internally consistent. While I think this is generally a good move, again, with my caveats, on the other hand, they're taking the opposite approach with vaccines. And you and I talked about the fact that they just dismissed a trial for the Moderna combination COVID and flu vaccine just out of hand. Well, wait, why are you allowing it for drugs but not for a vaccine? So there's a lot of inconsistency. I think that's where it's problematic. But in general, I think this is a good move.
But again, Dr. Pate, right? There's so much misinformation out there. It's hard to know what to know is right. So what should maybe a person be evaluating when it comes to a new drug that goes through this process? And I think I only have about a minute or so left.
Yeah, I think talk to your doctor because, first of all, you need to consider what drugs are already out there and that we do have more experience with. And second, does the result of this study seem to apply to your case? So talk to your doctor. Your doctor should be able to advise you on this.
All right. Well, as always, Dr. Pate, we so appreciate you. Remember, folks, if you have a public health question that you'd like for Dr. Pate to answer, just send us an email, idahomatters@boisestate.edu, and we'll get to it next week. And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.
Hi, it's Terry Gross, host of Fresh Air. Hey, take a break from the 24-hour news cycle with us and listen to long-form interviews with your favorite authors, actors, filmmakers, comedians, and musicians, the people making the art that nourishes us and speaks to our times. So listen to the Fresh Air podcast from NPR and WHYY.